Hello, my name is Representative Pam Powers Hanley, and I represent LD9 in Tucson in the Arizona House. Well, today, bright and early at 8:30 in the morning, the Regulatory Affairs Committee was hearing 3 sunset reviews. The one that I'm going to talk about in this video is for the Department of Insurance. So the Auditor General did a review, there were some recommendations, but my questions primarily focused on surprise billing. You may remember that in 2018, the Arizona legislature passed a surprise billing law. So surprise bills are healthcare bills that you receive after you've had care, after your insurance company has paid, after you've done your part of the payment, and then you get a surprise bill that says you owe more money that you didn't know you owed, right? Patients are receiving these bills like 6 months or a year after a procedure, which I think is a bad idea. So I asked the DOI director how many surprise bills they've gotten. And so I was surprised, actually, that although patients are allowed to complain about surprise bills that are $1,000 or more, the Department of Insurance only adjudicated 15 complaints in 2019, which resulted in $30,000 being returned to the patients. Well, that's 15 out of 75, and even 75 is not very many for a state with 7 million people. I can think of 15 people in my district that have surprise bills they're upset about. And so I don't think that this bill is working. On a personal note, my granddaughter was born a year ago, and she was in the nursery ICU at TMC for 3 months. My daughter and her husband got a bill for $530,000 for that care. Well worth it. She's a great little girl. The insurance company paid most of it. My daughter and her husband paid $5,000. But for the last year, they have received tens of thousands of dollars in bills from Selah's time in the NICU. There were dozens of little babies in the NICU when Selah was there. I'm sure all those families got those same types of bills, and they should be complaining to the Department of Insurance as far as I'm concerned. So there's something wrong with this process. They were supposed to have a portal so patients could go and make a complaint online. That exists according to the Auditor General. I also suggested that in the statute that it state that the surprise bill should have on the front of the bill in readable type that says that the patients have the right to contest the bill. Now, I don't know that that ever got on because it seems like patients don't know what their rights are. So I think the surprise billing bill from 2018 needs to be revised so it's actually doing what it should be doing. Patients should not be getting bills a year after care.